Hello again. Now we are ready for Chapter 6, Cancer Prevention Seminar, Chapter 6. And we will talk about some interesting factors that are also related to cancer. As I mentioned in several times before, cancer is not a disease that is caused for one factor, but is multifactorial. That means that smoking is one factor, diet is another factor, lack of exercise, pollution. And now we have one factor that is common in many countries, mostly developing countries. I can say that many cancers in developed countries are caused by essentially smoking and diet and other lifestyle behaviors. But in developing countries, the problem is still related to infections and contamination and even sexual transmission. So that's why we have to discuss this and do the right things and do the right preventions for that. 5% of the cancers are related to virus or other biological agents. So as we see, for instance, the human papilloma virus or HPV, that is now considered a sexual transmitted disease. In fact, the virus is very beautiful. I like the picture of it. But HPV is present in 99% of women with cervical cancer. Almost 100%, I would say. That's why sexual transmitted sexual relationship is related to that. And then is common, this cancer is common, the cervical cancer is common in women that have early sexual experience and multiple sexual partners. Also, AIDS is one, the HIV is one virus that can decrease the immune system and increase the risk of cancers, mostly Kaposi sarcoma, non-Hodgkin lymphomas, Hodgkin lymphomas, lungs, mouth, and uterus, especially cervical cancer, and then some cancers of the digestive system are also related to the influence of HIV. Here you see other pictures of cancers that are kind of beautiful pictures. On the left we have the HIV virus that we talked a little bit before. And then on the right side we have the HBV. HBV is the hepatitis B virus that are also related to cancer of the liver. Other viruses that can cause cancer are the cytomegalovirus that is related to the Kaposi's sarcoma, and then the Epstein-Barr virus or EBV that is related to the lymphoma of Burkitt is also a cancer of the intestine that is common to AIDS patients. And then the EBV virus is related to nasopharyngeal cancer. Nasopharyngeal cancer is a cancer that is common in Asian countries. I was working in China for 6 years, and this type of cancer was very common among the population of Hong Kong. Other biological agents that are related to cancer, I mentioned about the HBV, the hepatitis B virus, and the hepatitis C virus also are related to liver cancer. The HRV or human retrovirus is related to lymphomas, and the HP or Helicobacter pylori bacteria is related to stomach cancer. It's not a is not a virus anymore, it's a bacteria related to stomach cancer. And then we have the schistosomosis parasite related to liver and bladder cancer in many countries that have a problem with parasites, mostly in water that is contaminated. We have a picture of the Helicobacter pylori. It looks like a peanut with a green peanut with tails. But it is a beautiful picture, but is really not that beautiful bacteria to have in your stomach. This is a picture of the Kaposi sarcoma that is producing patients with AIDS with lumps in the skin, generalized all across the skin or across the body. Let's talk a little bit about alcohol now. We know that alcohol is also a cancer agent and related to is 3% of the cause of cancer, at least in the research that was done by the American Association of Cancer Research. In 2012, they consider alcohol as 3% of the cancer cause. And mostly cancers of the mouth, pharyngeal, laryngeal, esophagus, colorectal, breast, and liver are associated with cancer, with alcohol. Cancer association. Mostly these cancers are associated with alcohol. Here is a picture of increased cancer in the mouth. Here is a picture of a lesion in the mouth that is a pre-cancer lesion that should be treated. You might say, well, but if I have a cold sore, it looks like a cold sore. And I would say, okay, a cold sore will go away in 1 week. But a cancer precursor wound like this one will not go away. It will stay for months and years. So if you have something like that lasts for more than 1 month, you should check, because it might be a cancer of the mouth. And remember, many cancer of the mouth are not diagnosed, and then that will increase the risk of death when the cancer develops too much and form a tumor before you know it. The important part about it is important to emphasize that there is no safe amount for risk of drinking alcohol. Even the moderate drinker is at high risk of cancer. There is a dose-response association. What I'm saying here is that for heart disease is a little different. The science is saying that moderate drinking will cause less heart disease. And then heavy drinker will increase the risk of heart disease. In that case, moderate drinker will have no less risk of cancer compared to no drinking. Moderate drinker will increase the risk of cancer, and then the risk will increase as you increase the intake of alcohol. Now let's talk a little bit about the sun. We know that about the sun contains. We know that the sun contains ultraviolet radiation that can cause mutation to the DNA and increase the risk of skin cancer, mostly for people with dark skin, as me. So the risk of cancer increased by 2%, or the sun is responsible for 2% of the risk of cancers. It is one cancer that is very common worldwide, is common in white-skinned people. Most of the cancers are 90% carcinomas, and then we have 4% of melanoma. It is rare in the skin covered by clothes, and then is mostly common in the face. And then that's why you should avoid sunburn and avoid prolonged sun exposure. That idea to go to the beach and stay laying down in the sun is not a good idea at all. And also going to tanning sessions where they tan the skin with ultrasound rays is not also a good idea. But the sun is a skin natural antibiotic, and then is used in sterilization of the environment in hospitals, and then is important for the formation of vitamin D, which is in itself an anti-carcinogen. Is also important for diabetics because sunlight can drop the blood glucose levels and increase the levels of endorphins and help to prevent depression. So you should not avoid totally the sun, but go to the sun with protection, with sunblock, and go to the sun in the times not close to the midday time. And as we know, cancers are produced in the face mostly, so a hat is a good idea. I use a hat all the time when I go to the sun, and sunglasses are also a good idea, and sun protection factors like the creams that you put in the skin should have a SPH of 30 or higher. SPH is sun protector factor. So don't forget, if you use a sun protector cream or a lotion, buy one that has at least SPF of 30 or higher. Other cancer factors are related to other things like pollution. But we are going to talk about pollution. We'll talk about family history, about growth and perinatal factors, socioeconomical factors, reproduction, environmental pollution, medical procedures. So 5% of the cancer is related to history. So it's important for you to know if you have a history of cancer in your family. Like breast cancer, ovary, and colorectal cancer run commonly in family. Is like breast cancer, if you have heard about the history of the famous artist Angelina Jolie, that she was found to be BRCA positive, and we will talk more about that when we talk about breast cancer individually. But she had a family history of cancer, and then she did some treatment for that. In fact, she have a mastectomy to prevent cancer in the breast. Even though a person might have a gene for cancer, Dr. Murdoch in this slide is saying that faulty genes load the gun, but lifestyle pulls the trigger. It looks like for you to have the cancer, you have to put two things combined. Now, the genetic predisposition and then your lifestyle that will trigger it. And then we go to what is happening today with the epigenetic theory, that people might have a gene for something, but the gene will never be expressed if the person does not have a lifestyle to trigger it. So now we know that genes are there, but they might depend on the lifestyle. You might have a gene for lung cancer, and the only way that you are going to get lung cancer is if you smoke, meaning that the smoke will trigger that gene and will express that gene, and the gene will be active. And then we go to the issue of nature or nurture. Maybe nurture is more important than nature. There are other occupational factors that might be related to cancer. So this is mainly for people that work in an environment that has those substances in the air. So that's important that they have masks and they have procedures to protect their breathing and their skin against these types of cancer. Like mineral oil is related to cancer of the skin. Arsenic with the cancer of lungs and skin. Asbestos is related to lungs and the mesothelioma cancer that is being very common for people that have worked in environments, in houses, or in construction in the past when they use asbestos in the roof and use asbestos as a construction material. Benzene is related to leukemia. Formaldehyde is related to nose and nasopharyngeal cancer. Vinyl chloride to liver and angiosarcoma. And painting materials to lung cancer. So the environment pollution is related to 2% of cancers. The environment inside of, mostly inside of place, but in general, people that live in urban areas, they have more cancer than people that live in rural areas. So that's called attention for us to move or try to be more frequent in areas that have a lot of trees and far away from pollution of cars and industry. Smokers have more lung cancer if they live in urban areas. And then arsenic in the water increases the risk of bladder cancer. This happens not in the United States, but some other countries in Asia and Africa that have arsenic, natural arsenic in the water, increase the risk of arsenic cancer. Industrial pollution is related to lungs, to cancer in the lungs, in the bladder, and the bone marrow. So now we go to the cancers cancers that are related to growth. It looks like overweight babies increase the risk of adult prostate and breast cancer, and girls that grow too much increase the risk of breast cancer. And this is probably due to the excess of energy and calories given during growth. And then we might trigger the excess of insulin and the excess of leptin and even the excess of estrogen, and might increase the risk of breast cancer in these girls, and maybe even the babies will increase the risk when they are giving these types of foods that will produce hormonal changes more than they are used to. Regular exercise for adolescents are important because they can also decrease the risk of female cancers like breast and ovary, and then prevent the girls to be overweight, prevent the early menarche, and this will decrease the risk of breast cancer. And the social-economic status is also related to cancer, and people don't understand why is that happening. But it looks like when a person is poor, he has more tendency to smoke, to drink alcohol, to eat whatever food person has, and mostly is more fat and more junk food, and we will eat less fruits and vegetables, and we will be exposed to more infections. And this is responsible, so the socioeconomic status might be responsible for 3% of cancers. Reproductive factors are related to 3% of cancers, and we are talking mostly about the women type of cancer. Like if a woman has a first menstruation too early in life, and then and has less kids, or have kids had kids in the late age, and have a late menopause, or have no kids whatsoever. This will increase the risk of women's cancer, mostly the risk of breast cancer, because will increase the time that the woman is exposed to estrogen, that is one of the hormones related to increased risk of breast cancer. Medical procedures, mostly radiation, like X-rays, is interesting. We use radiation to kill cancer, but radiation can cause cancer and increase the risk of leukemia, lymphomas, melanoma, myeloma, thyroid, lung cancer. And mostly those cancers are, those risk of these cancers are mostly for those that work in the radiology department, or to exposed too much with radiations because of their type of work. Drugs that are using transplant to avoid rejection of the organ being transplanted might block the immune system and increase the risk of several types of cancer, mostly lymphomas. People that have to do dialysis are at higher risk of kidney cancer. Those that use anabolic steroids, we don't prescribe anabolic steroids, but some people might have a prescription for that. But people that use, those athletes that want to have bulky muscles and use more steroids, they will have a higher risk of liver cancer. Also, a drug that is used to prevent one type of cancer might increase the other type of cancer. Tamoxifen is used to prevent remission of breast cancer, but it might increase the risk of endometrial or uterus cancer. Phenacetin was one of drug that was used in the past. They don't use anymore. It increased the risk of the kidneys. And anti-contraceptives or birth control pills might decrease the risk of ovary and uterus cancer, but increase the risk of liver and breast cancer. So it's something that has to protect you in one side, but it might increase the risk on the other side. Other factors that are difficult or impossible to change or prevent is what we are talking about here. So family history, you cannot do anything about family, but maybe you can improve the lifestyle to avoid the expression of some genetic or family genes. And so you have occupational, industrial factors. You can protect with masks, but nobody will use masks in the city. So we advise that people to go frequently to places that are low in pollution. Socioeconomic factors are somehow difficult to avoid, but the socioeconomic is not just the socioeconomic, but the habit of socioeconomic people. So they can increase and decrease those risks that are not associated with economics at all. And then they might have less cancer. And so we have reproductive, environmental, and medical procedures that not always are under our way to control. We finish here all the modifiable cancer factors, and we know that there are some that we can prevent, some of them we cannot. And as a personal, I would say do whatever you can to avoid the cancer factors, to have a better, healthier diet, and control your weight and do enough exercise. In terms of marriage, have safe sex, mostly if you have sex with your wife or with your husband, then you have a protection against the transmission of the HPV, human papilloma virus, that will be transmitted from women to men and to men to women. So, and will increase the risk of cervical cancer. And then don't forget that alcohol is a cancer producer, and then sun is also something that you should use a sunblock or a hat and avoid too much sun at noontime. Develop a healthy lifestyle. And don't forget, when Jesus came to this world, he said, I came that they might have life and that they might have it more abundantly. Abundant life is also prescribed by Jesus Christ for us. So even if you have cancer, but you have the hope that one day you will live in a country, in a place, in an environment that will not have any more cancer, any more death, any more disease. This will give you hope. This will give you peace. This will give you the expectation that things are not going to be as they are here, where we have all sorts of diseases and all sorts of cancers. And Jesus came to offer this to us, abundant life. Maybe starting here if you have a good lifestyle, but if not, you might have it eternally when Jesus comes back to this world. Thank you very much.